Today we are going to cover up the scalp, and scalp is the skin over your head. It is not the skin over your face or your neck. It's just the skin over your head. So that's why we call it the scalp. The scalp itself, if you go through the anatomical sense, you will be defining the scalp in a sense that it refers to the layers of skin and subcutaneous tissues that cover the bones of your cranial vault only. So the scalp has different layers. So in remembering the layers of the scalp from upside down, you will be moving from upside down in order to talk about these scalp layers. So there are main 5 layers of the scalp, and you can remember them by just using the mnemonic that is the scalp itself. SCALP. This is the mnemonic used for understanding the layers of the scalp. So the first layer is your skin. The outermost layer of your scalp is your skin. The skin actually contains the hair follicles in it and sebaceous gland. Thus, this is a common site for sebaceous cysts. Another layer, the second layer that we will talking about, is the cutaneous tissue. You can remember by that the connective tissue. It's the dense connective tissue. It's by C. C means connective tissue, so it's dense connective tissue, which connects the skin to your epicranial aponeurosis. The third layer is your aponeurosis. That is your epicranial aponeurosis. Epicranial aponeurosis, which is the third layer, which is a thin tendon-like structure that connects the occipitalis and your frontalis muscles. The fourth layer, that is an important layer, which is called the loose, which is represented by mnemonic L, is called loose areolar connective tissue, which is also a thin connective tissue layer that separates the periosteum of the skull from your epicranial aponeurosis. The last layer is obviously your pericranium, or you can say the last layer is your periosteum, the outer layer of the skull bones. It becomes continuous with your endosteum at your suture lines if you move towards the suture lines. And there's an important clinical related over here, which is your which is also it's related to your scalp infection. So remember, if somebody asks you what is the danger area of the scalp, in most OSPs, in most examination, the teacher usually asks that what is the danger area of the scalp. So remember that the danger area of the scalp is the area of loose connective tissue. Remember that one. Use this one, loose areolar or your loose connective tissue is the dangerous area. Why is it? This is because pus and blood spread easily within it. Remember why we call it the dangerous area, because the blood and the pus spread easily within it and can pass into the cranial cavity along with the emissary veins. And if you can see these veins, this is your emissary veins, this one right over here and this one from here, and the infection, the blood and even the pus can easily go across these veins. So this is also due to this one. Therefore, infection can spread from the scalp to the meninges, which could lead to your meningitis. From you got infection from outside, you got hit by something, and from these emissary veins the blood is going to drain back into your inferior sagittal sinus, and from there your infection can travel downwards and infect your dura mater, or you can say these your meninges, which is kinds of three layers. That is your dura mater, arachnoid mater and pia mater. We'll be talking about the meninges in another video, but in this section we'll be only covering up the scalp. The second topic, we're done with the basic introduction of the scalp. Now we'll move towards the arterial supply of your scalp bone. So this is another diagram I'm be using thanks to the Teach Me Anatomy application, which gave me an access to a right picture. In arterial supply, I'll be talking that, remember this one, that scalp receives a rich arterial supply via your external carotid artery, which actually has three branches, and also the ophthalmic, which is not shown in this picture properly, ophthalmic, and a branch of the which is actually a branch of the internal carotid artery. So remember, the scalp is supplied by two main arteries, that is internal carotid and external carotid. From external carotid there are three branches, that is superficial temporal, the occipital, and posterior auricular. And from the internal carotid there is a branch we call that ophthalmic artery. So total there are four arteries which are coming from two main arteries, that is the external carotid, which gives three arteries, and internal carotid, which actually gives a one branch. So this one, these are the branches of the internal carotid artery. So this one, superficial temporal, which supplies the frontal, you can see in red, which supplies the frontal and temporal regions right down there. This is your temporal region, and from on the other side, on the upside, it's supplying the frontal. And the posterior auricular artery, which is this one shown in yellow color, it supplies the area superiorly and posterior to your auricle. You can see down there superior and posterior to your auricle. And the last branch that is of the external carotid artery, which is the occipital, supplying the scalp, is actually supply the back of the scalp. You can see in this diagram the back of the scalp is supplied by your occipital artery. By the name you can remember it because there is an occipital bone behind. Now let's further talk and move further and talk about the venous drainage. Alright, so the venous drainage of the scalp can be divided into two parts, that is your superficial and your deep components. So the superficial actually drainage follows the artery above. Remember, we have studied the superficial arteries, though the superficial venous drainage is similar to that arterial system, except it's moving downward and arteries are moving upward. So in that sense, the superficial drainage, we have got the five main branches, that is your superficial trochlear vein, your supraorbital vein, your superficial temporal vein, and your posterior auricular vein, and your occipital vein. And the deep, which is your temporal region of the skull, is actually drained by pterygoid venous plexus, which is not shown here in this picture, but it is drained. The deep temporal region of the skull is actually drained by the pterygoid venous plexus, and which is actually the large plexus of vein situated between your temporalis and your lateral pterygoid muscles, and it also drains into maxillary vein. Now let's talk about the innervation, the nerve supply of your scalp, which is not pretty hard, it's simple. Remember, the scalp receives cutaneous innervation from six main nerves, which arise from two nerves, that is your trigeminal nerve or your cervical nerves. The branches are, there are four branches of actually the trigeminal nerve, that is your supratrochlear nerve, there is the supratrochlear nerve, the supraorbital nerve, the zygomatico-temporal nerve, this one, and the last branch of your trigeminal nerve, which is the auriculotemporal nerve. This one, auriculotemporal nerve. Now let's talk a bit about these nerves. So remember these are the branches of your trigeminal nerve. Remember this one, and these on the back side are the actually branches of your cervical nerves. We're coming to the cervical nerves in just a bit. Let's talk about the trigeminal nerves branches which are supplying your scalp. First, talk about the supratrochlear nerve, which is a branch of the ophthalmic nerve, which actually supplies the anterior-medial forehead. Again, the supraorbital nerve, branch of the ophthalmic nerve, which supplies a large portion of the skull between your anterior-lateral forehead and your vertex, right down there. You can see this in the supraorbital, right down. You can see these nerve supply, exactly going upward towards the vertex. The third branch is your zygomaticotemporal nerve, which is the branch of the maxillary nerve. Remember these other, like they're writing down that it's a branch of these nerves, maxillary nerve, and maxillary nerve is finally a branch of your trigeminal nerve. So ultimately, these are all the branches of the trigeminal nerve. So zygomaticotemporal nerve is a branch of the maxillary nerve, which is it's also a branch, which is the branch of trigeminal nerve, and this supplies your temporal region. Remember this one, zygomaticotemporal nerves supplies your temple. The other nerve, that is the auriculotemporal nerve, which is a branch of your mandibular nerve and which supplies the skin anterior superior to the auricle. This is the anterior of your auricle. This is your auricle. This is the anterior and superior part of the auricle. Is supplied. This is a perfect picture explaining this scenario. You can see this anteriorly and superiorly is supplied by the auriculotemporal nerve, and these are only supplying the scalp. Remember this one. Now let's talk about the cervical nerves. And the cervical nerve, we have the lesser occipital nerve, the greater occipital nerve, and the great auricular nerve, and the last one is the third occipital nerve. First, let's talk about the greater occipital nerve, so which is derived from the posterior ramus, which is the division of C2, and supplies the skin of the occipital region. You can see it's going exactly upward and supplying your whole occipital region. The other one is your third occipital nerve, derived from posterior ramus of C3 and supplies the skin of the inferior occipital region. Exactly down there, supplying the inferior region of the occipital nerve. And the third one is the lesser occipital nerve, which is derived from the anterior ramus of your C2 and supplies the skin of the posterior to the ear. This is your ear, and posterior to the ear is supplied by this lesser occipital nerve. You can see down there this picture and perfectly. Now let's talk about the great auricular nerve, which is derived from the anterior ramus of both C2 and C3 and supplies the skin posterior to the ear and over the angle of the mandible. You can see this is the mandible of the skin, and over the is supplying the behind the ear and right down there. So these are the nerve. This is the nerve innervation of the scalp, and this is a period. And if you want to know any other thing regarding anatomy or physiology or biochemistry, please make sure to leave us a comment, and we'll be making a video regarding that topic. And keep visiting Thai Schooling. See you next time.